Hello friends, I am Dr. C.S. Yajnik. I am the Director of the Diabetes Unit at the KEM Hospital, Pune. We are the pioneering diabetes unit and have been functioning for last 40 years. We were the first one to actually have a specialized diabetes clinic in the town. Today, we are going to discuss the vexatious issue whether diabetes is reversible, whether it is curable, or is it only treated. So I think first I would like to explain to you what these words mean and what is the everyday happening and what might happen in rare situations. So when a patient of diabetes comes to me, we advise them on different aspects of lifestyle, and depending on the type of diabetes, we also decide whether they need insulin or not. As you know, there is type 1 diabetes, which is due to total absence of insulin in the body because of destruction of insulin making cells in the pancreas. These patients cannot survive if we don't provide them with insulin from outside. So reversal of type 1 diabetes today is not possible. Many alternative pathies people have claimed it. Please don't believe it. We have seen disasters in patients who have followed such advice. The commonest garden variety of diabetes is type 2 diabetes. This happens in adults usually who are overweight, who are stressed, who have say faulty dietary habits, they don't exercise and they have a lot of stress of the system. These patients are good targets for actually managing their lifestyle, and if you are successful in treating these so-called risk factors for diabetes, namely excess weight, less physical activity or stress, then they might temporarily reverse and remain with good glucose even when you stop treatment. This is important to know that it is a temporary phenomenon. If you follow them long enough, it's not usually possible for people to actually follow such lifestyle over a long period of time, and then they come back with high sugars. There have been studies in Scotland where very grossly overweight people with an average weight above 100 kg were made to lose 15 kg of weight, and 50% of them did not require treatment at 1 and 2 years following this loss of weight regime. So it's not impossible, but they had to put in lot of efforts, very strict dieting and other aspects of treatment into motion to achieve this. In my practice, I do see type 2 diabetes patients who revert back to normal glucose levels, at least for some time. They make it actually a point to adjust their lifestyle, improve their diet, physical activity, reduce stress, and then they are able to live happily without treatment for some time. If they again go back to their original lifestyle, then the sugars start rising and we might have to treat them with tablets. So it's possible, but usually it is not very sustainable. Many of you perhaps know about a variety of diabetes called gestational diabetes. This is a relatively new thing which has been described in last couple of decades, and it's diagnosed in pregnancy. These women usually say they do not have or did not have diabetes before pregnancy. So it is assumed that the rise in sugar represents a losing battle from a system which is already compromised but cannot face the stress of pregnancy. As you know, normal pregnancy has an additional big burden of improving the growth and the development of the baby, and for this there are number of hormonal and other changes. These changes overcome that woman's ability to control glucose level by adequate amount of insulin. If her system is weak, the sugar starts rising. We call it gestational diabetes. Interestingly, when delivery occurs, the stress due to the baby and the placenta and all the high levels of hormones is suddenly removed, and therefore many women come back to normal glucose concentrations. But important thing to remember is that this usually lasts for only a while, and in later life, with increasing age, increasing weight and other factors, they are at a much higher risk of diabetes. In our follow-up studies, what we found is that in 1 year after delivery, almost 45% of women developed higher glucose. Half of them diabetes, half of them what we call pre-diabetes. By 5 years after delivery, almost 70% had got high glucose, and 10 years later, more than 85% had high glucose. So we take gestational diabetes as a warning signal to behave in appropriate way to reduce the load on the pancreas and avoid sugar from rising. But that is one example where a lot of women remit or go in remission at least for some time after the delivery. So that is a peculiar situation. Finally, I am going to tell you that you will read many reports in newspaper about newer ways of curing diabetes, especially type 1 diabetes. And people talk of different gene therapies, etc., which work in animals like mice or guinea pigs, but none of them is even remotely near the human experiments. There is one small study in Canada and United States where a particular type of intervention improved function in type 1 diabetes patients for 1 year or so. But these are really experimental methods. They are not available anywhere else. So don't go away with the impression that already there is a curative treatment for type 1 diabetes. I think you have learned about these important issues, and if you have any queries, you want to solve your questions, you are most welcome to come and visit us at KEM Hospital Diabetes Unit, and we will provide you the necessary information. Thank you.